like to talk to you today about some problems that happen with the low back. A lot of people, when we're working in through the hips or working in through the legs, don't realize that much of this originates in the lumbar spine. And what you're seeing, the clinical manifestations, things that the person's complaining of, are more symptoms rather than they are causative. So if you're doing really good work in the periphery of the lower body, and it's just not staying or it's not working the way that you think it should work, then what I do is I suggest that you kind of back up just a little bit and look towards the low back. One of the most common things that happens back there that perpetuates and isn't kind of self-limiting is when things sublux forward or backwards. So you get an anterior, posterior, or posterior and anterior subluxation, especially with with vertebra 5. Vertebra 5 can tend to get stuck. So do all the stuff that you normally would do, but I also suggest that there's a couple little ranges of motion that you can do that will sometimes help to shimmy those vertebrae back up to where they were supposed to be. So I'm going to demo those for you in just a couple minutes. This would be after, maybe before you've loosened everything up with acupuncture, with cupping, with gua sha, with electric stem, but also after, particularly after, because after your acupuncture treatment, the body is going to be ready to basically give those up and reset them. Until they're reset and decompressed, it's going to keep referring into the periphery. You're going to keep getting either pain, numbness, tightness, soreness that just won't seem to resolve. So hopefully, basically, you sit right there. All right, ready? All right. So basically, if lumbar vertebrae get pushed left or right, a lot of times that's self-limiting. But when the lumbar vertebrae get pushed front to back, anterior, posterior, posterior, anterior, then what you can get is you can get certain levels. In particular, L5 can get stuck out of that position. You've got to understand that the tissue around this area is probably a good 3 inches thick on most people, and the spine is at least 2 inches down on most people where the discs are. So this little technique that I'm going to show you can sometimes, in conjunction with your other techniques, help to shimmy that back into place. So once you've loosened things up just a little bit, just applying some gentle pressure left, gentle pressure right on the sacroilliac joint, okay? And then further, grab the as-is in the front, fix, very gently fix, and I just felt a couple of vertebrae go when I did that. Very gently fix with the treating hand. And then just move your way down the transverse processes. Then go back to gentle compression, gentle compression. Go through it again, both sides. I usually switch off sides now. Again, compress, compress. Use your legs for this much more than your arms. Then back to compressing SI, back to compressing SI. Then compress SI as you pull. Compress SI as you pull. Just felt her SI joint go back into place. SI, SI. And that's basically it. Now, you can also sometimes trick the SI joint by going back into place. Could you roll over for me for just a second? Perfect. By getting the patient to cross your arms up high. Fix your hand on the as-is and very gently rotate. Now, I didn't do any high velocity thrust or manipulation. This is just a gentle compression. I would do both sides, back and forth, and eventually this will probably get things to go back into place for you.